My name is Dr. Bahar Esmaili. I've been a dentist for 15 years, but at the cusp of 10-year practicing dentistry, I figured out the way that the body is organized and how mouth develops has a lot to do with the way we breathe, and it induces a lot of symptoms that I used to see but didn't know how to address. So the last 5 years, I've been doing a lot of training, special educations, and examining different protocols of treatment of airway, TMJ, and addressing lack of nasal breathing. What I figured out the last 5 years is that body and mouth are interconnected very, very, very heavily. The way our mouth develops has a lot to do with the structures of our body, the way we walk, the way we breathe, the way we organize ourselves against gravity. So I started working with so many different professionals, chiropractors, physical therapists, myofunctional therapists, myofascial therapists, functional medicine, understanding body doesn't just fall apart in one area. There's so many different interconnected parts of our human body that need to be addressed for the function of breathing through the nose. Because the most important thing about our body is breathing. And to properly breathe through the nose is everything for the health. But to properly breathe through the nose, we need to make the diaphragm work, we need to make the tongue work, we need to make the neck work, and removing fascial structures, chemistry of the body, nervous system, all of that need to work together. The other thing that is important is the sleep. The 8 hours we spend in bed. How important is it that we get good, juicy, restorative sleep? When we go to the deep stage of sleep, our brain clears the metabolic waste and toxicities from our brain so that our brain can have more memory space and can actually connect, make neuron connections and all that jazz, especially in a growing child. When we're not able to properly breathe, when our bodies are stuck in a sympathetic state of fight or flight, and our sleep is impacted, we're not getting the benefits of deep sleep, which also is going to affect our health. So I decided to turn all of my trainings and expertise into a holistic approach to airway, TMJ, and chronic pain and chronic diseases. And how blissful has it been the last 5 years treating hundreds and hundreds of patients all over the world, helping them with their journey. And I'm providing all that information and education to my audience here. And I hope this introduction was helpful and you once and for all found out what is my message, dentist going holistic.